Of course, it should definitely be treated. Especially when it comes to the flu, this illness is characterized by high fever and can lead to severe complications. It is said that treating a fever can shorten the duration of illness to 7 days, whereas without treatment it may last up to a week. However, this is, of course, a generalization. Neglecting ordinary fever can lead to complications such as sinusitis, otitis, and other diseases. Regimen for individuals with cold and flu. Working without considering illness is very dangerous. In addition, by doing so, you not only put yourself at risk, but also endanger others. It is crucial to take sick leave from the first days of illness and stay at home. By doing this, you protect yourself from the consequences of the illness, and you avoid becoming a source of infection for others. Bed rest. Regimen. It is important to adhere to bed rest, especially when the fever is high. After the fever subsides, it is possible to transition from semi-recumbent position to normal posture within 1 to 2 days. Hydration. Consumption of liquids such as syrup, tea, compote, and mineral water is crucial during high fever, as the body loses a significant amount of fluids during this time. A sick person should consume at least 2 liters of fluids per day. Diet. The appetite of the sick person sharply decreases. Under no circumstances should you force-feed a sick person. During the flu, especially when the fever is high, it is necessary to abstain from meat and heavy, fatty foods. When the fever returns to normal, start with fresh chicken broth, as it contains a substantial amount of cysteine, which has a mucolytic effect. Symptomatic treatment. Although symptomatic treatment does not directly affect the viruses causing the illness, it significantly alleviates the patient's condition. Since the symptoms of the flu and cold can vary, patients often need to use several drug preparations, those for reducing fever, cough suppressants, throat pain relievers, and more. Fever-reducing medications. This group of medications improves the patient's condition. They are particularly important for children, individuals with chronic heart and lung diseases, and the elderly. Attempting to completely normalize the fever is not recommended. A decrease of 1 to 1.5 degrees Celsius significantly eases the patient's condition. Among fever-reducing drugs, you can mention paracetamol, ibuprofen, aspirin, and analgin. However, it is important to note that medications containing paracetamol should never be taken at the same time as alcoholic beverages. Aspirin can only be used in adults. Its use in children during flu and colds may lead to the development of Reye syndrome, damage to the liver and nervous system, which is a severe illness. Analgin can be used in the form of intramuscular injections only when other fever-reducing drugs do not yield results. Fever-reducing drugs should only be taken when the fever reaches 38.5 degrees or above. If the patient is a small child, elderly, or has chronic heart, nerve, endocrine, or lung diseases, the fever should be reduced when it reaches 38 UTC. During high fever, it is not advisable to use mustard plasters, medical banks, and other means that accelerate blood circulation. Do not wrap the person with a fever in warm blankets, as it can further increase the fever. Sore throat. During a sore throat, you can use warm jam or honey tea, warm milk with added soda, gargling with calendula, witch hazel, or chamomile, and rinsing with salted water. 1 to 2 cups of water plus a pinch of salt can be helpful. There are many throat sprays, lozenges, and medications available in pharmacies for throat pain. Treatment of a runny nose. Most patients prefer to use nasal drops or sprays from pharmacies, considering them completely safe. However, these nasal drops are not entirely risk-free. It is necessary to clean the nose with saline solution, 1-2 cups of water, plus a pinch of salt, or nasal drops containing seawater, available in pharmacies. Treatment of cough. During a cold, the treatment of a cough with tea with added honey and lemon or milk with added soda provides good results. Colds, flu, and antibiotics. They do not use antibiotics for the treatment of colds and flu. The reason is that these illnesses are caused by viruses, and antibiotics only affect bacteria. Sometimes complications, inflammation of the lungs, middle ear, etc., can develop during a cold or flu. In such cases, antibiotics are prescribed. Antiviral medications. These medications are prescribed by a doctor. Using them within the first 24-36 hours of illness provides a good effect, reducing the duration of the illness and the risk of complications. In addition, family members without illness can use antiviral medications as an extreme preventive measure.
Thank you for watching this video. If you enjoyed it, don't forget to like, share, and subscribe.